everyone. Welcome to Derm Talk. I'm your host, Dr. Shinjita Das, a Harvard dermatology resident. Today I've got a great episode for you guys. We're going to be talking about laser treatments. I've got here joining me Dr. Jennifer Lin, who's actually a graduate of the Harvard Dermatology Residency Program as well. She's currently a board-certified dermatologist at the Brigham and Women's Hospital and has a particular interest in pigmentary disorders and laser treatments. Dr. Lin, thanks so much for joining us today.
Thank you, Dr. Das. It's a pleasure to be here.
So before we start talking about laser treatments, can you tell us a little bit briefly, what exactly are lasers?
Lasers we actually use all the time. They're what is seen to read CDs. So they're actually around us all the time. And in the case of the medical setting, we're harnessing the energy from a laser to treat specific lesions on the skin.
Great. And there are a number of different types of skin conditions that we can treat with lasers. Can you give us examples of certain skin conditions that we can treat with lasers?
Absolutely. In fact, the best way to separate out lasers are by thinking about what they're treating. So we have lasers that specifically treat red areas. This could be big blood vessels and rosacea or other red growths on the skin. We also have lasers that treat brown spots. So typically these are sunspots. And then we have lasers that heat up the skin, and we can use that to treat scars as well as photo damage, so skin that over time starts to sag. So everyone wants something from lasers, I feel like, these days.
Absolutely. And in the Harvard system, we actually see patients of all sorts of skin colors. And I've got a fact or fiction for the audience. So fact or fiction, lasers are not safe for people with darker skin. We'll give you guys a moment to think about it, and Dr. Lin's going to help answer that question for us. So what do you say to that fact or fiction question?
So fiction, there are some lasers that can be used quite safely on darker skinned individuals, but it's really important to emphasize that you really want someone who's trained in skin to treat darker skinned patients because the risk of harm is higher in darker skinned individuals. So specifically, you can remove hair safely on darker skinned individuals, but we use a specific type of laser for them, and we still take great precaution in this case. And we can also do acne scar treatments as well, quite safely in darker skinned individuals, again, knowing what risks we have to take with them. So these are some of the main lasers that we use for darker skinned individuals. It's certainly possible. If you have a board-certified dermatologist treating them, sometimes there are measures we take before and after to ensure that there's no side effects from the laser itself.
Great, and I want to definitely hit on those points later on in the show. So before we move on, you mentioned laser hair removal, and that's something that people commonly come into the dermatologist's office asking about. Can you tell us a little bit about laser hair removal?
Sure. I mean, again, I think lots of women feel this way. They have unwanted hair on the upper lip or the jawline, even the neck area. Sometimes, especially if you have curly hair, they grow back into the skin. They cause pigment changes, redness, irritation. And even people who just normally want to have less hair because they don't want to shave as frequently, you can remove hair from your underarms, from your bikini area, from your legs. It's probably the most common procedure performed in the US. And there's a lot of spas that offer it now in addition to dermatology offices. I again wanted to emphasize that for darker skinned individuals in particular, because the risk is a little bit higher for side effects, I would prefer that they do it with a dermatologist.
Absolutely. And specifically, if someone were to be considering laser hair removal and has darker skin like you and me, what types of lasers might they hear about from their dermatologist?
So from the dermatologists, some of the most common lasers are the diode laser, the alexandrite laser, and the ND-YAG laser. I think some of these are offered in spas, but more commonly what we see in spas are intense pulse light lasers. An intense pulse light is actually not a true laser in the sense that it uses a light source, but it's not amplified.
And you've been alluding to some of the side effects that patients may expect to see, or maybe have unwanted side effects. So what are some of those that people may come across during their treatments?
Yeah, so the most common side effects are some discomfort from the treatment itself, and we can give a numbing cream for that beforehand. Redness, swelling. Sometimes the hair takes a little longer to fall out. Unwanted side effects, however, are darkening or lightening of the skin. This is usually temporary, but definitely in darker skinned individuals, this is a bigger risk, and this is the one I'm really talking about in terms of making a decision to choose between a spa versus a dermatology office.
Absolutely. And since you're talking about the question of having maybe some pigmentary changes, we always tell our patients, make sure you don't have a tan for at least 6 weeks before you have a treatment. And especially afterwards, you want to make sure that you're not going to be getting tan so you don't run the risk of developing these pigmentary changes. Another question that people have for us is, well, I'm going to have a laser hair removal and I'll get one treatment and I'll be done. Is that really the case?
No, it always takes multiple treatments, and there's a good reason for this. Your hair is always growing in cycles, so when you get the treatment, there's some hair that's dormant that's going to grow out in the next few days to weeks, and therefore you need to sequentially hit and treat the skin in order to get all the hair follicles. So it's very difficult to estimate how many treatments you need. A common figure may be 5 to 6 treatments, but again, it really depends on the individual.
Absolutely, and it also depends on the body part that you're treating. So
Right.
Areas with thinner skin, for example, the armpits or the bikini area, might respond a little bit more quickly, but areas on the back or areas that have thicker skin may take more treatments.
Right.
And so we always counsel our patients that it's really hard to predict exactly how many treatments will be required because everyone's a little bit different.
That's right.
And another question for you is, well, okay, fine. People recognize that they need multiple treatments, but can they just come in day after day, come in 7 sessions in a row and have that treatment?
No, so again, the hair has to actually be there. And so this is an important point. Before you go in for a laser hair removal, you don't want to pluck or wax your hair because that removes the hair and there's nothing to treat. You really want to only cut down or shave the hair. For some women, this is really difficult to do on the face, but that's what's preferred. And you can't do it you can't do it every day. It has to do with how fast the hair is growing. So usually we say every month. For areas around the face where the hair is growing faster, they can come in every 2 weeks.
Okay. And again, just to emphasize what Dr. Lin said, definitely try not to pluck the areas or epilate the areas because you want the hair actually present because the laser is actually targeting the pigment in the hair to target the stem cells and prevent the regrowth of the hairs. Great. And so afterwards, once someone has had a laser treatment, what do you counsel them in terms of wound care and taking care of the areas that they've had treated?
So you want to keep it moist to allow the skin to heal. So a lot of good emollients, lotions are really helpful. The most important thing is to keep it out of the sun. So just like you said before, 6 weeks before, you want to not be on a Caribbean vacation. 2 weeks after, also, you don't want to be out by the beach. So for that reason, lots of times people choose to do these treatments during the winter months, as you can imagine.
Exactly, and it's perfect. This time of year is a perfect time, especially in about a month or so when most people who do have a tan have lost that tan, and then going pretty much until about February or March here in Boston, they'll be kind of avoiding the sun pretty well. Great. You alluded to another thing, Dr. Lin, is that the difference between getting laser hair removal in a dermatologist's office versus at a med spa or one of the shopping centers at the malls. Can you tell us a little bit about the differences between those, or is there any?
I think that there are some differences, primarily that dermatologists are trained to deal with the skin in all different conditions. And I think generally if you have light colored skin, you probably could do very well at a spa. They tend to use intense pulse light, although increasingly they are also obtaining the 3 lasers I mentioned earlier, the diode, the alexandrite, and the Nd:YAG laser. But especially for darker skin individuals, the most side effects I've seen from laser hair removal are on darker skinned individuals. And it's just harder to predict how they will react to the laser. And this is because the laser targets the color of your hair. And so if someone has darker pigment in their skin, it can injure the skin much more easily. And this is also why tanning is no good for laser hair removal. So for all these reasons, I do feel strongly that if you tan easily, then you would be better off doing laser hair removal with a dermatologist.
Exactly. And as a dermatologist who does laser, you actually spent extra time after dermatology residency to learn about lasers and specialize in it. And so it's very important whenever you're getting treatments to really ask about your physician's qualifications and their experience dealing with lasers, and also their knowledge about the potential side effects. And that's really a message that we want to get out to the audience here. And so that's really helpful for us to know, what people should expect. Another area that patients come into the office asking about is they come in with an Amazon printout of at-home laser devices. So can you tell us a little bit about those, and are they any good?
Yeah, so this is a growing field, and I think we're just going to see more of these devices. They're actually a diode laser inside it, so it's a bona fide laser, and obviously the energy is not as strong as what is available in the office. Nonetheless, I think they can be quite effective. They're better for touch-ups, so meaning after you've done your initial course and you have less hair to deal with, you could use that at home to kind of take away the stray hair that does come out over time. Again, if you are someone who tans easily, you have to take extra precaution. You probably want to talk with your skin doctor about it, just to make sure you're using it correctly, that you're avoiding the riskier situations that we've already discussed, which are having a tan, having extra color. So for these reasons, I think it's definitely good to speak with your physician before using it, but I think it's going to be a growing market. I think it's something that is going to become more and more popular.
Absolutely, and I think it's a great idea if patients have a device in mind, just bring that device into the office, and the dermatologist can look into it for them and figure out if it's made by a reputable producer, if it's safe to use, because oftentimes it's really hard to tell from the marketing that's on online websites what devices are actually safe to use. Great. Did you have any final words about laser hair removal before we moved on to the next skin condition?
I just want to emphasize that laser hair removal, very popular, can be very safe and effective in darker skinned individuals. We just want to caution them that the side effects are greater, and therefore get educated about it in your doctor's office. Get it treated with someone who knows skin in particular, and happy lasering.
Yeah, and I think this is going to be, the message that you're giving us is going to be something that really follows with any types of laser treatments. So we'll be emphasizing the same things over and over, and you're going to get tired of hearing us, but we really want you guys to be aware of the safety issues around lasers. They're great devices, but again, you just have to be cautious with them and make sure that someone who is knowledgeable is treating you with them. So let's move on to another common skin condition that we see concern, or acne scarring. So basically acne hyperpigmentation and scarring that occurs in patients with darker skin types. Can you tell us a little bit about some treatment options about it?
Yeah, so acne scarring, so common in darker skin types like us, right? We get hyperpigmentation, meaning it turns brown, and that's often what bothers us more, is that when we walk out, we have brown spots on our face. And so for those treatments, first you want to get your acne under control.
Absolutely.
So prevention is the key. If you're not getting the acne lesions, you won't get the side effects from the acne itself. Following that, a lot of bleaching creams can definitely help with reducing the pigment. When you're left with the scars, which can be sunken in scars, raised scars, or what we call ice pick scars, where you kind of see holes in your skin, laser therapy can be useful in these situations. Again, we're quite cautious with our darker skin patients. We have special protocols for them. So our energies are different that we use for these particular patients. But they can, with a particular treatment called fractionated photothermolysis, it's a big word, but it essentially is a 1550 nanometer laser. And what it does is it heats the skin and it tightens the skin, and it seems to promote scar remodeling so that over time the raised scars get less raised, the sunken in scars get less sunken in.
And something that you're mentioning is that these scars get less noticeable. And so when you're counseling patients about their acne scars, do you expect the scars to completely disappear?
It's hard to achieve 100% clearance, but the skin is always healing. So over time, scars get better. And with the help of some of the topical treatments and the lasers, things do improve. It's hard to say 100%. It's hard to predict without looking at the individual person. But certainly people can improve to a point where they feel more comfortable. With this particular laser, the fractionated laser, in general, again, repeat treatments over time. You have to be patient, but over time they can improve.
Absolutely. And again, something that Dr. Lynn pointed out, notice that she didn't go straight to the laser. She talked about optimizing acne treatment. So that's something that you can discuss with your dermatologist about making sure that you're on the right treatments for your particular type of acne. Once your acne is under better control, there are some non-laser options that we usually start with first to try to improve the appearance of it. And then finally, if the scars are really noticeable and if it's something that is affecting your quality of life, we definitely have those lasers available. And so what you'll notice in a lot of the way that we treat patients is it's a very stepwise approach. We don't go straight to lasers or straight to surgery, but we have a toolbox. And so I really appreciate that you emphasize that for us.
I like that idea, toolbox.
Exactly,
yes.
Exactly. And then how quickly should people expect to notice improvement in their acne scarring?
So the effect of the laser is a little bit delayed. So typically within a month, they'll feel like they're getting better, and then within their max effect is at 3 months. And since most people do this treatment every month, when they come back in for the next treatment, that's when they're saying, oh, you know what, this is really looking a bit better. Most people appreciate the fact that the texture of the skin improves, even if the scars aren't immediately 100% better. They feel their skin feels better. So